Welcome to the Health Deli, your local stop for a fresh take on community health topics. Come on in, grab a number, and let the guys behind the counter, Mark, Ben, and Mike, tell you about today's specials.
And Mike.
Welcome to the Health Deli. I'm your host today, Mark Young. And with me, I have a couple of esteemed colleagues, Andrew and MJ. How are you guys doing?
Hey, guys.
Good. I also have some other people with me today.
I'm already out.
I like to think I'm the illustrious.
Yeah, I don't mean to throw you under the bus, Ben.
It's okay. I know.
But
I'm
I do
I'm a
mean to throw
casualty of
Mike
it.
under the bus.
So the quote I came up with when I had a student once say, "Why'd you throw me under the bus?" And I said, "I didn't throw you under the bus. You were just laying in the road."
You
But
just
you
refused to stop or turn the bus.
did not-
I got
did
you.
not swerve at
I
all.
see how you are. It's a beautiful day here in Big Rapids, Michigan, on the campus of Fair State University in the Health Deli Studios. How many episodes have we done? Like a ton, right? Over 50? Is that right?
Over 55. By the time this one comes, it's probably closer to 60 or more. So
And did you remember back where we started in the basement with the foam stuck to the walls? And now we have this
dungeon.
beautiful
Painted
studio.
foam.
did they
It was
destroy that
amazing.
building?
No.
They should have.
We should go back there as part of the 50th episode or 70th
Oh my
or
whatever
whatever we're on.
It's probably condemned though.
Probably.
The
No,
smell
it's
is
storage now.
the smell is horrible.
Yeah. That was only since you were there. So what have you guys been working on?
So I am currently putting together an episode about prions, which I've teased a little bit before. So chronic wasting disease, mad cow disease, all these kind of weird things that we aren't 100% sure how they occur. So kind of an interesting mystery that we'll be unraveling.
That may be I'm probably most excited than any episode we've done about that.
Wow.
Seriously, I'm very interested in that topic. So.
Yeah, it should be pretty good. You may be disappointed because there's not a lot of information out
Well,
there.
I would be if
but-
Mike was doing it, but I think I'm
Wow.
not going to be. I think I'm going
Wow.
to be impressed.
All right. Well, I'm going to live up to that expectation.
Wow. It's a low bar, a very low bar. And I'm working on questions from seniors. So looking to find out what questions are on the
Questions
mind of
from
the
your
greatest
peers.
generation. What?
Questions from your peers.
Other
Well,
people
yeah.
at the home.
Well, from my grandkids' peers.
Of course.
I'm what they refer to as a super senior.
Woo.
We had an episode on that. Right? Super centenarians.
Yeah, you did.
Yeah.
Green zones or blue zones or something.
Blue zones.
Blue
yeah.
zones.
You actually paid attention. That's amazing.
Wow. Yeah. Osmosis.
Well, I'm working on that men's health episode. I've been teasing for like 5 years now. Still working on that, and I'm also thinking about an episode about how to handle hazardous medication safely, and if there are risks associated with like transient exposure to medications. So,
Okay. You're talking about like nuclear medicine and that kind of stuff?
a lot of different things. So even if you're not taking the medication, just being around it, can that be hazardous?
Yeah,
or not?
some of them get absorbed through the skin if you're touching it.
Exactly.
Cause pregnancy problems, or
Maybe you'd like to do the episode.
No,
You know
no.
so much.
Wow. The animosity is off the charts. So what are we talking about today, Mark?
So today's topic: embarrassing bodily functions.
Oh crap! This is that episode.
Yes. So this is a fun episode.
Maybe not for me. I'm right next to you.
Right.
I love it. I got a
Not
front row seat.
Not a lot of science, not a lot of studies, but just kind of answering some questions I have, like, why does my body do this?
Is it going to be a scratch and sniff episode?
It might be.
Are you trying to tell me we don't have a lot of studies on farting?
Well,
Oh, there's probably a lot on farting.
actually, there's more than you'd think. But no, there's not, maybe the level
Randomized
of
controlled
study
trial.
that there is with influenza, perhaps.
Double blind.
Yeah.
You can't mask a smell like that. Oy.
Right. So we all know that we yawn, right? And we all know what happens when we yawn.
Everybody else yawns.
Yeah. Everyone yawns,
Yeah.
and it is completely normal.
Except Mythbusters said that yawning is not contagious.
We're going to talk about that.
Okay.
Not about Mythbusters, because I actually didn't know that. So we will talk about that when we get to that part. So we know that we yawn, but why?
I yawn when I'm sleepy.
Right.
I'm eepy.
I need more oxygen. I have to level out your oxygen CO2 levels. It's a brain
You're on
response.
the right. Yes, you're on the right path. So we yawn there's been a couple theories in the past. One theory had something to do with our eyes. So that actually lubricates our eyes because of the opening of the yawn.
That actually sounds like a stupid theory.
And it has been pretty much disproven, honestly. But there may be some people that are still perpetuating that theory. It's really not
People, if you're perpetuating that theory, you're stupid.
Mike's upset with you.
So the
Should I say the opinions expressed by Mike do not necessarily reflect those of the Health Daily?
so then there was the leading theory that we yawn to have kind of an increase of oxygen.
Yeah.
So we, have this big breath increase of oxygen, and kind of true. But there's been more research done to say that we yawn and we draw in that air, and it actually brings the temperature of our body down. And that actually has more effect on the alertness. So it's our body needs to be more alert. So it signals for a yawn. And when we yawn, it decreases the temperature and it gives us a little bit of extra.
Sounds like panting that a dog would do.
We're going to talk about panting in the sweating part, but not so much here. But
No, that actually makes sense to me. And I hate to say that because when you get, sleepy, feel like really comfortable, you're warm, you're snugly, Ben's in his sweater or casual.
Pajama bottoms.
Yeah, I don't want to go there.
Oh,
but again, you're trying to cool your body down. I can get
then,
alert.
And then the cool air that you're bringing in actually has an increase in your heart rate. So your heart rate increases because of that, and then that pumps that blood flow to your brain, increasing alertness.
Interesting.
What if I just throw water on you? Would you quit yawning?
Maybe.
So every time you yawn, I'm going to throw water on you.
Yep.
And then you could just say thank you.
So
I will. I have no idea what it has to do anything with yawning.
I'm trying to increase your alertness.
But is yawning normal? We said yes. About 20 times a day is the average adult yawns. I feel like I'm way below average. I'm going to start counting, but I don't think I yawned 20
So I've yawned 20 times already during this episode.
Mike's not very alert.
Our listeners are only yawning, once a day.
Of course.
Right, with all this great conversation.
So I guess then why do I want to yawn when somebody else yawns then? Because if it's specifically to wake myself up, if that's the anatomical reason.
Right. So there's a couple different theories on this. One is that people yawn when others yawn due to a phenomena called, you don't have the script, do you, Andrew? Echopraxia. It's when a person sees a behavior and then they will mimic that. And the idea kind of from an evolutionary standpoint is if one person yawns, that means their body is signaling that they need to be more alert for some reason. And everyone else around them should probably be also alert.
Interesting. So is that why Mike just follows me around and copies me all the time?
I'm echopraxing you.
Oh my gosh. It was anatomical all along.
He actually took my joke. I hate that.
But that is really interesting. I mean, it makes sense.
It does.
From that perspective.
I think it does. Yeah. Kind of interesting. All right. So yawning, it is normal. It's safe. And we maybe understand a little bit more about why we do it. Hiccups.
Ooh, I hate hiccups.
Yeah,
hiccups
aren't
are the
they
worst.
annoying? Do you get a lot of hiccups? Not a lot.
So I haven't. I feel like I remember having them a lot more when I was a kid than having them now. I don't know if that's a thing or not, but
yeah,
I haven't recently.
I actually would agree with that. I remember getting them a lot more when I was a kid. You got a lot of hiccups, Mike? Just in your brain?
What's that? I hate this. I hate these people. I hate this episode.
We haven't even got to the fun ones yet.
Yeah.
There's nothing fun about you two.
Do you guys really know what happens during a hiccup, though? I mean, I didn't before I researched this.
So I have not read this yet. I'm going to guess that somehow air has gotten stuck in your throat. That's my guess.
I thought it was more like a diaphragmatic spasm.
It is diaphragmatic. So it is a spasm in the diaphragm. So, your diaphragm normally pulls down when you inhale. So it, fills your lungs and then it relaxes so that your lungs can exhale. But if something irritates that diaphragm, it can spasm. And then
I'm spasming right now.
Yep. And when you spasm, then you have this forceful inspiration. So you're sucking in air really quickly. And that's what makes that hic sound, hic sound.
Okay.
Yeah.
And so then what causes me to do that?
A lot of different reasons.
Okay.
So the classics are some kind of irritation to that. So if you eat too much too fast, it can cause a hiccup. Sometimes if you're nervous or excited, that will create like a nervous response to and stimulate the diaphragm to do that. Carbonated beverages.
Yeah.
Too much alcohol. I mean, we've all seen the old school like cartoons with the hiccuping person drinking too much.
Yep.
Stress.
Tom and Jerry.
A sudden change in temperature. I've never noticed that personally, but perhaps.
Is specific kinds of food associated with? If I have like very spicy foods, will that
I didn't notice
irritate
that.
it more or anything?
I didn't notice that. No.
See, it's interesting because you said carbonated beverages, and I was going to ask that because, like McDonald's Diet Coke, if I drink it too fast, I always get the hiccups.
Specifically their diet.
Yeah. Yeah.
So is it normal? Yes, hiccups are of course normal, but generally they should go away rather quickly. We'll talk about in a little bit how to make them stop, but they shouldn't last obviously for a long period of time. But in rare cases, they can stick around. And it's usually because of damage or an aggravation to that nerve connected to the diaphragm.
So the nerve's not the diaphragm itself.
Right.
Okay.
And it's sometimes these nerves, obviously our nervous system is very complex, but sometimes chronic hiccups can be caused from a hair touching your eardrum. What? Yes. I could not believe that either, but I read a case report. N
of one. Yeah, that's,
N of one.
I'm convinced.
N of one. But it made good sense that could happen because of that nervous system response. Also, tumors, goiters, cysts in your neck, obviously.
Okay. Sure.
Can precipitate chronic hiccups.
So it sounds like we need to get something like a little feather and just poke inside Mike's ears until we make him hiccup.
You do it, I will kill you.
Yeah, there's actually a medication indicated. Mike will probably know this because he's
old,
right?
Yeah.
So I've heard of this before. This happened in my residency. Someone had intractable hiccups, and we gave them something.
It's old school.
Oh, okay. Maybe I'm thinking something different then.
Old school antipsychotic.
Thorazine.
Yep.
Whoo!
Yeah.
Let's go.
Chlorpromazine.
Yeah.
I've never seen it used for it, but
I've seen it literally once.
Nice.
In all of my years.
That's a good experience.
Oh, all of his years. That's so cute. He thinks 6 months equals a year.
So it doesn't?
A little fun facts about hiccups, if there are any. How to make them stop, right? Because everyone wants to make it stop.
Yes. Holding your breath.
You've heard, don't let the cat out of the bag.
Yeah.
But that is probably the best technique.
Okay. I thought you were going to tell me that was wrong.
No, that's actually the only one that works.
Yeah. I mean, you've probably heard like hanging upside down, having someone scare you.
Yeah,
those kinds of things. None of that's been.
That's just people messing with people. It's like, hey, you know what? If you do 25 jumping jacks, then fall on your face and bleed, your hiccups will stop.
Yeah. Do you know why though that works?
No clue. I thought for sure you're going to tell me it doesn't work because it never helps me.
So when you hold it in, I actually thought maybe it was just because you're holding your diaphragm like steady, right? It can't move, so then it kind of just calms down. That's not true though. It's the increase in carbon dioxide.
Yeah.
Okay.
So yeah, it has a dilatory effect, a relaxing effect on the diaphragm. Now obviously it's not foolproof because everyone who's had hiccups has tried to hold their breath and it doesn't just instantly stop them.
Right.
But yeah, it does work actually. So
interesting. Okay.
Yeah.
So unlike yawning, which you said served a function, like to cool your body down and stuff like that, do hiccups serve a function or are they just one of those?
No, not that I could find. And I did actually look.
So it's like you and your third nipple. You serve no function.
No funk. Well,
okay.
I don't want to know.
It's a conversation starter.
Fair.
But
Andrew's got a question.
Well, are you going to talk about Charles Osborne at all?
I don't even know who that is.
Barely not.
Okay, drop some info on us.
Yeah, so there's someone who had the hiccups for 68 years.
Really?
Yeah, starting in 1922. And I remember looking this up before.
Really?
Yeah, and it
Plucked a hair out of his ear and they
finally
stopped?
went away in 1990. It subsided.
But they didn't assign like a causality. Why?
I could read the whole article.
How did this guy
read the whole article? And did they only go away when he died? I mean, what the heck, man?
No.
Did he hold his breath then finally after 60 years?
He tried it.
Yeah.
Somebody scared him. And,
Because that would be my thoughts. How do you fall asleep? Because when I'm hiccuping, I'm just annoyed.
True. I don't know. I mean, I don't know.
Huh.
Interesting.
Although sometimes, those things might stop when you're asleep. I know that sometimes when I have like irretractable coughing, I'll notice that sometimes I do fall asleep and then I notice, hey, I'm not coughing. But then I wake up and I start coughing again.
Yeah, and actually, we did an episode on sleep a long time ago, and remember that eventually your body will just simply sleep.
Right.
It's almost impossible, even if you try to keep someone awake, to keep them awake all the way till death.
Well, because you can die from lack of sleep. So
Right.
theoretically, you can keep them awake until they die.
Right, but it's a really difficult. It's not like they're keeping themselves awake. You would have to provide external stimuli. You know what I mean? Let's try it. That sounds like an episode.
I don't like Mike's smile right now.
Let's try that.
Well, this is an interesting article. I can't. There's too much here, but look up Smithsonian Magazine, the case of Charles Osborne. It's an interesting one about hiccups.
Yeah.
He probably didn't have a job in radio.
Something about hanging a cow for butchering, and this accident started the hiccups, and then it goes on where he can't find a cure for years and years and years. So, I mean, starting way back in 1922. So,
Yeah, we can have a
whatever
follow-up on that.
Huh.
Yeah.
Interesting.
All right, so probably this is everyone's least favorite involuntary response or bodily function: vomiting.
Yeah.
We all know what vomiting is, and that's when that lining of the gastrointestinal tract becomes inflamed and irritated. We call that, gastritis. And it can happen for a number of reasons. It can happen from viruses. It can happen from food. It can happen as a consequence of another disease state. So there's lots of things that can precipitate vomiting. Things even such as a concussion or a head injury, brain tumors, things like that. So lots of things can make us vomit.
Well, it's crazy because this just gets into how tightly connected all your senses and stuff are, because smells can precipitate vomiting.
You're right.
Thoughts can precipitate vomiting. Motion can precipitate vomiting. And so, I mean, it's not just a irritant of the stomach, but there's a definite kind of a total sensory.
Stress too.
Yeah.
I mean, there's people that vomit before theater performances every time, So there's just a lot of things that can make a person vomit.
I puke in your truck before every episode of the Health Daily. I get so nervous.
Sure.
But there is a benefit in some situations, yes? Or is it always a benefit?
Right. So it's definitely normal to vomit. I mean, if I would assume most everyone has. And it's probably most likely kind of due to to prevent food poisoning. Or to prevent some kind of infection. So we want to
get the toxins out.
Exactly. Get rid of whatever is there. And that even the stress-related response could be part of that as well. So if you're under a huge amount of stress, and your body's in this fight or flight response, your body doesn't know what to do, but it knows it should probably get rid of whatever's there because that could be potentially harmful.
Or you drop your load so you can run faster.
Maybe. So to help with vomiting, there's actually mixed reviews. So you've probably heard about the brat diet.
Mixed reviews on vomiting.
There's some people really like it. No, there's mixed reviews on what to do when you are vomiting.
Well, you mentioned the mixed reviews on people liking it or not. Didn't the Romans used to have vomitoriums? Like they would have big meals and then they would go and vomit so they could keep eating.
I don't know if that's what a vomitorium is.
That would be the worst. I resist vomiting at all costs. I am that person that even though sometimes when you're ill, you should, I do not. I hold it in.
Yep, it's not pleasant.
Until it comes out your nose.
Well, yeah.
Well, this reminds me of the show Jack that came out in the early 2000s.
That was my
where
generation.
they would do things specifically to vomit. They probably did stuff like this in Fear Factor.
Oh yeah,
right. Like
probably.
chugging an entire gallon of milk as fast as possible.
I've seen someone
Definitely
try that. Yeah.
elicits a vomit response.
Yeah.
All right.
So if you're experiencing vomiting though, the brat diet, bananas, rice, applesauce, toast probably is the best option.
Okay, so like
you want
blander food?
very bland, kind of starchy foods, and then it's also best to wait before you try to eat or drink anything. So vomiting can cause dehydration, right? Because you're losing water. So I think a common misconception is people, as soon as they vomit, try to drink water again because they're worried about that. I like the idea of them drinking water, but you really need to wait 15 minutes for your digestive tract to kind of calm down. So don't try to drink water right away. Let it calm down, then slowly introduce some water and then some brat foods.
Okay, hang on. I got to throw this in here.
Go for
the
it.
vomitorium with the Romans, myth, urban myth. A vomitorium, according to Mr. Wikipedia, is a passage situated below or behind a tier of seats in an amphitheater or stadium through which big crowds can exit rapidly at the end of the event.
Yep. So essentially, people are
So they're
vomiting
out of interesting.
All right.
Does vomit have another connotation?
I think it just means expel.
Okay.
I don't know that. Maybe we could Google that.
Google it. Get on it.
Andrew's like, dang it, I shouldn't have asked. So fun fact about vomiting. We haven't touched on vomiting associated with morning sickness and pregnancy.
Yeah.
So I kind of thought about this because my initial thought was evolutionary. Like, why would we evolve like that? Because it would put you at increased risk, you would think. You'd be sick and you're trying to,
Right, you don't have as much food,
but you would also
need food
just
for yourself and the child.
stay and not go hunting and not put yourself in harm's way.
So two reasons that are kind of leading. One is that if you're vomiting during the first trimester when the baby is absorbing a lot of nutrients and is more susceptible to infectious disease, you're less likely to contract these infectious disease, listeria, those kinds of things. So even though you're kind of just indiscriminately vomiting, you're still less likely to absorb some of these harmful pathogens.
Interesting. And you're also feeling nauseous, I'm guessing, right? So maybe you're less likely to want to go out and be adventurous with your diet.
You stay home. So if you think about prehistoric humans, it was a dangerous place. I mean, ask Mike.
it was. I mean, it was horrible.
The dinosaurs and the bears.
Right. There was a lot of dinosaurs, bears, right.
Battlestar Galactica.
Yeah. So there was a lot of things trying to kill you. And if you were out of your cave, you were more likely to be killed. So if you had to stay home, probably more people were born.
I actually coined the term man cave back in 300
in
BC.
your cave.
Yeah.
Wow. Yeah.
Andrew's got a vomit related thing.
Well, everything I find just says eject matter from the stomach through the mouth. So it's all pretty much related to the stomach.
It's kind of what come first, the chicken or the horse? Was it vomit?
The chicken or the vomit?
Yeah.
Yep.
Did it
Actually,
come
the
from
vomit
your
came after
stomach?
the chicken. We know that because the chicken was bad. So now you're trying to expel it.
Nice. All right. I think we've vomited that to death.
Well, let's
Yes.
talk. I mean, so vomit, everybody does it. We know it occurs. You talked about dehydration, but there's some other really serious, sequelae that can occur because of vomiting. You can aspirate your GI contents. You can get a, chemical irritation of your lungs called the pneumonitis. The muscle contractions and the retching can actually cause damage to your esophagus.
I've heard of people breaking ribs.
All of those that have had a Mallory Weiss tear in their esophagus, raise your hand. That's me. And so because you're throwing up so much, you get a tear and you bleed into your stomach, and then you throw up digested blood, and you look like the Exorcist, and it freaks your wife out. Now she won't use that bowl that you were throwing up in to cook anymore because it still is in her mind.
It's
It
traumatizing.
was my
That's
favorite
fair.
bowl.
You were talking about people vomiting based on what other people are saying. Thanks, Mike. I'm glad there's no camera on me today.
Yeah. Well,
So it happens, but there's can be some serious side effects, associated with it. So it's good to make it stop.
Right. And I mean, there's often time in pregnancy too, there's normal morning sickness, and then there's where you can't eat and you have just terrible amounts of morning sickness. Of course, then that's, time to see your doctor and make sure you're getting the nutrients.
Yeah, don't see me.
Don't see you.
Nope, because I vomit when I see vomit.
So let's pause for the Healthy Minute, brought to you by the Winery at Young Farms. Today's Healthy Minute is know your cholesterol level. Cholesterol is a key factor in our overall cardiovascular health. High levels of bad cholesterol, or LDL, can lead to plaque buildup in arteries, increasing the risk of heart disease and stroke. Conversely, Good cholesterol, or HDL, helps remove bad cholesterol from the bloodstream. Regular cholesterol checks help identify potential risks early on, allowing for timely intervention through lifestyle changes or medication if necessary. This proactive approach can significantly reduce the risk of health issues and promote long-term well-being. The CDC recommends to begin routine cholesterol testing at the age of 9 to 11. Most adults should have their cholesterol levels checked every 4 to 6 years, but those with risk factors such as a family history of heart disease, obesity, or high blood pressure may need more frequent monitoring. Consult with your healthcare provider to determine the best schedule for you. That was the Healthy Minute, brought to you by the Winery at Young Farms in Mecosta, Michigan. Please visit www.thewineryatyoungfarms.com for more information. Now, back to the health.
Boom, chicka, boom, healthy. So something you said there was just crazy, like starting screening kids 9 to 11 for high cholesterol. It used to be, not until your 30s or 40s that you would start screening.
When I was just getting out of pharmacy school a long time ago, it was 40.
Yeah.
And then there was this push to get it to 20, so you kind of had a baseline. But yeah, now 9 to 11.
Wow.
Yeah, we have a family history of it. In fact, I was just diagnosed and recommended to take medicine. So I've been trying some other things besides lifestyle diet. I've been trying red yeast rice powder. So I'm going to be tested again in a couple months. We should probably talk about that.
We should.
We should go back to the supplements.
French fries.
And cholesterol is one of those point of care things. We could kind of
we can talk about, is your cholesterol elevated because you absorb your dietary cholesterol, or is there more a component to genes? Right. And so that's going to be important.
Good question.
We could actually test his cholesterol right on the episode.
Awesome. We could do mine too. Yeah. I was first diagnosed with high cholesterol when I would donate drug-free plasma for research in my lab, and they would go,
"You have drug-free plasma?"
I used to, and they'd always go, "Why does your blood look like jelly when we spin it down? It shouldn't be this white jelly." And I'm like, "Oh, whatever." And it's like, yeah, my cholesterol is like freaking out of control. Jeez. Anyway.
You're a mess.
Oh, yeah, I am. It's amazing that I've lived this many centuries.
You're right. It's funny. All right, so our next kind of uncomfortable involuntary response, goosebumps.
Like the book?
No, not like well, maybe. Does it give you goosebumps? I've never read.
They are spooky, so it might give somebody.
So that could give you some goosebumps.
That's probably where they got the name from. Anyway.
So we all know what goosebumps are. Is there kind of a reason for it? Why do you think we have them?
I want to know why they're called goosebumps. I don't see geese on my arm.
It looks like a plucked goose. So when you pluck the feathers off of a chicken or a goose, you know how it looks bumpy?
Okay, so now I have finally learned something today.
It took a while. I have a theory. We get goosebumps because if we're like threatened, so like if we're scared, we want to look bigger. And so that makes the raising of your skin.
So here's my theory with it, is your hair on your arms can act like it's a receptor, and detect motion. And when you get the goosebumps, it raises up and becomes more susceptible to detecting those motions.
Neither of those theories did I really explore. Those are both really good.
Mine's better.
No, yours.
Yeah, mine is so much better.
His is way more scientifically based than mine.
Ben is just trying to swell up with goosebumps.
I'm trying to get swole, dude.
The overall consensus is it's kind of a holdover from when prehistoric humans had more hair. Because in other species,
we definitely did.
In other species, they basically have the same response of goosebumps when they need to stay warmer. So it fluffs the hair up, kind of lifts the hair up, and it actually makes them warmer. Because we've lost most of our hair over however long Mike's been alive.
Really? Seriously, you lost most of your hair?
Shut up, Mike. Shut up. Shut up. Jeez.
Another sound bite.
By the way, I don't get goosebumps on my head
because you got no hair,
right? So, but then we obviously get goosebumps though other times when we are not cold, right? So I had to look into it and understand kind of why we would get goosebumps.
The neurotransmitters. So yeah,
you're right. Yep, you're right. So we have this neurotransmitter called norepinephrine, and norepinephrine receptors on these erector pili muscles in our skin.
He's the what muscles?
Yep, that's what I said. So that when we have a release of norepinephrine when we're cold, that helps to warm us up. But we also release norepinephrine when our fight and flight response. So when we have that stress, we have that same reaction.
Get excited, get startled, anticipatory.
Yeah. Okay, yeah, sure. It's kind of interesting.
Well, who would have thought that my most interesting thing that I learned today was about goosebumps
and why they're called goosebumps.
And why they're called goosebumps. Yeah, and I mean, there's some actually really interesting studies just recently done that actually proved that. Believe it or not, this is not like old knowledge. And they used mice. The researchers used mice, and they were able to shut off the norepinephrine receptors and then give them stimuli to actually arrive at this conclusion.
It seems like a lot of work just for goosebumps.
Yeah, you're right. Because there's no like bad thing that goosebumps.
Well, I was going to say, does somebody named Charles Osborne Jr. have goosebumps for 68 years?
Maybe.
No.
You didn't even have to look that one up. You just knew.
I want to know if there's been chronic cases of goosebumpage.
Yeah, I don't know. But I mean, these researchers, I should not laugh. I mean, they're doing amazing research, I'm sure, but
well, it's
you just wouldn't think a lot of people would really dedicate their careers.
Well, but anatomists and physiologists, I suppose they're looking for the reason bodies act in a certain way to look to see if there's correlations with that and other things.
Yeah, that's great.
And who knows if that research 10, 20 years down the line is the basis of some kind of new therapy that we have, right? Like,
goosebump therapy. So where do goosebumps usually occur? So you mentioned that you don't get them on your head.
I didn't. I mean, it has to be a different distribution of, depending on body parts, right?
Because I only think that I get them on my arms and maybe on my legs.
Yeah.
I don't get them on my trunk or my hands.
Do you have a trunk?
Oh yeah, it's in the back of my car.
That's interesting. And like a dog, when you see a dog get angry or scared, the hair stands up on their neck. Yeah, I don't know.
There is something I can't pronounce, but also known as chicken skin, that will make it look like someone has goosebumps for a long period of time.
Interesting.
Keratosis.
Keratosis?
K-E-R-A-T-O-S.
Yeah, but what's the second one? Polaris? I've driven a Polaris.
I've seen Polaris.
I got nothing else to add to that.
All right. So moving on from goosebumps, burping.
All right, now Mike's ready.
So what happens when you burp? Does anybody know? Yep, that right there.
Wow. On demand.
So every time that we swallow food or drink, a muscle has to relax to allow that to happen. And when we burp, the same muscle relaxes to let air out.
Yeah, that was going to be my guess. Releasing excess gas that happens
and
while
that's
eating.
the only time that muscle is relaxed. All the other time it's contracted. And I don't even know how to pronounce the name of this muscle, the cricopharyngeus. That's the muscle that kind of holds our burps down.
Okay.
So why do we burp? It's obviously to release gas.
So we don't
that builds
explode.
up. Exactly. Yeah.
Interesting fact, I had 80% of my stomach removed and can no longer burp.
Oh my gosh.
You may have no burp syndrome. We're going to talk about that.
Oh my gosh.
So burping is obviously normal. Some people have more control over that muscle and can kind of control burps and not. There are people that can't burp at all. There are people that can't burp on command. There are people that very readily can burp on command. So there are kind of differences in how much control we have over that. And we've all heard someone burp on accident, and it's very much normal.
So are some people are predisposed to burping more than other people?
I didn't really look into
like a genetic
that
aspect of that at all?
I mean, a lot on your diet, right? So if
Okay.
you're eating foods that are fermentable, where they're giving off gas, then you're going to be more likely to burp, right? So carbonated beverages too. I mean, you drink a bunch of carbonated soda, you're probably going to burp, right?
Makes sense.
Yeah. One of the cool things about burping that I had never heard of, and it wasn't even discovered until 2019, is a syndrome called no burp syndrome. And in these individuals, that muscle will never relax for burping. So it still relaxes when they eat food, so they're able to eat food, but it won't allow any burping out. So before they really studied this and kind of looked at that muscle, they were mistakenly diagnosed with things like acid reflux, irritable bowel, intestinal infections. And to these people, the fact that they never burped really just didn't occur to them because they didn't really understand how often people do burp.
Right.
That might be my mom. She says she never burps and she never farts.
Yeah, your mom's a liar.
Every wife ever has no burp syndrome.
So for someone with actual no burp syndrome, where does all that gas go then? Because we can't release it through.
So you can, which we'll talk about as another involuntary response, you can fart it out.
Makes sense.
But yeah, but
kinda
they have
weird.
a
My
lot
mom
of,
has to do one of those.
Yes.
you do have to do one of
Let's
those.
call your mom. Let's call
Because-
her out on this one.
Because it's very normal to build up that air in your stomach and it has to leave.
Yeah.
So, but to have no burp syndrome, it's not like you don't burp very often. You simply never burp. So that is the diagnostic criteria. And it is uncomfortable. They have lots of, stomach discomfort, things like that. Also, it is a never ending syndrome.
So there's
So
no
it's not
cure.
like, I haven't burped today, so I have no burp syndrome. But there is a treatment. So this is not without any treatment options. You can actually get a Botox injection. It's a surgical procedure where they inject that muscle with Botox.
Okay, where is this muscle?
It's wrapped around your esophagus.
Yeah, no.
Well,
no,
it's an
no.
invasive procedure. I mean, this is not like something I'm going to do, in a
Right.
in a
You probably
doctor's
got to make
office.
sure you're getting exactly in the right spot, right? And so
and that will
Oops, missed.
a little bit
Missed again.
and that will a little bit relax that muscle and provide relief. So there actually is a
Interesting.
treatment for that.
how long does it last? Because I'm guessing it's not a permanent solution.
know, they-
I didn't look into
Botox
it.
Has to be
usually,
maybe a month
It
or
probably
two.
depends
Yeah.
on how much they use.
Yeah, true.
well, your body clears the Botox toxins. It
Right.
goes away from the So yes, it does.
I don't know how well perfused. Yeah, I mean, there's a lot of factors. I don't know.
All right, so I'm seeing the signs go up.
Yeah,
and I would have never thought that this would be this interesting. Where I would ever utter these words is like, can we finish this on another episode?
I would love to finish this on another episode, but I'm going to give a teaser before we go. Because we have to still talk about on episode 2, the follow-up episode, farting. We still have to talk about sweating, sneezing, laughing, and pooping.
Wow.
My goodness.
Lots of great things.
Yeah. Are we going to talk about why your poop is a color that it is and stuff like that?
I don't know. Maybe I'll bring in some pictures.
I don't want pictures. I just want
He wants
science.
live samples.
No. Oh, heavens, no.
Not in the deli. We're selling food here, Mike.
Jeez, Mike, come on.
All right. So I'm about ready to hang up the sign.
Where are you going to hang it? Over your burping
In the door.
sphincter thing?
I'm going fishing.
Yeah, that'd be for the best.
Okay. Let's put this one in the books. I am excited about part 2.
So am I.
All right. 1 margarita, 2 margarita, 3 margarita shot.
There you go. Thanks for stopping by the Health Deli to sample some of our wares. We're open 24/7 on Facebook and Twitter at The Health Deli, or visit thehealthdeli.com to send us a question or find any of our locations. Please come again. We will be regularly stocking the shelves with fresh content and new wellness specials. As always, we want to give a special thank you to Andrew Tingley and the crew at Ferris State University's Television and Digital Media Production Program. Until next time, so long from the Health Deli, where the topics are tasty, the takes are fresh, and the discussion is free.